First of all, starting to do the bed making, we need to make sure that the linens are well folded in a way that we need to use easily. If not, it's not going to work that much. And you start with the last linen you are going to use. It has to be the first thing on your tray. Perfect. Okay. So now we need to, the next thing that will be on, it will be the top sheet. Let's look if the top sheet is well folded. If not, we refold it so that it does not disturb us. But however, mostly in the hospital, it's going to be folded by a specialized individual, so it is certainly going to be well folded. That does not guarantee the fact that it might be well folded, so you need to be sure so as to be able to arrange. You can see that ours is not well folded, so we need to make sure that we fold it in such a way that we can remove without any problem. With keen attention, this is how we fold our linens so that it becomes easier for us to unfold when we want to do bed making. Go back. Yes, fold it now. Correct. Here we have our top sheet well folded. It will be placed next after the blanket. From the top sheet, what we are going to use next, we are going to use a Macintosh, a draw sheet. And because there is no draw sheet, we are going to improvise with one bed sheet. Tu regardes, non? Tu n'as pas besoin que je explique encore. C'est ça qu'il dit qu'on va chercher le temps pour faire ça. Mais comme Dieu a demandé pour Madame Beverly qu'elle vienne vite nous sauver, qui est moi de ne pas utiliser ça? Okay. Always make sure that the length at your side is equal to the length at her side. If not, you are short and she's having excess. Alright. Let's fold. Yes. We are trying to fold them so that it becomes easier for us to use. So we have our draw sheet. After the draw sheet, the next thing we are folding is the Macintosh. The same will go in one. Place our Macintosh. From the Macintosh, the next thing will be the bottom sheet. draw the other side and then you stretch on the other side. Why is there no light? Okay, let's fold now. Yes, take half, not full. Half, yes. Okay, so now we've arranged our liniens as beautiful. Yes, we've arranged our liniens as beautiful as we are going to use them, because your linen must be in such a way that you are not going to be looking for something within the blanket or the Macintosh. So let's now start the process in itself. We've arranged our liniens and now we are going to remove them and make, which bed are we supposed to start with? A closed bed? Then we open. Closed bed. Closed bed, okay. All right. Oh, God will bless you. So we're about to make a closed bed. I hope you can see how they are communicating. You are not two nurses, two enemies working on the same bed. You are two colleagues working on the same bed. So you should be able to communicate with each other in case the other person is not going your way, just so that they know. You can see how straight the bed is just by unfolding it. You see the hand. It is the hand close to the bed that goes under to lift the mattress. And here you see the envelope corners that they are trying to do. No matter how small your bed sheet is, you can comfortably do an envelope corner. You see that? This is the envelope corner. The envelope corner. Okay, someone always compress. Madam Mary, always compress so that Madam Beverly should do it, and then Madam Beverly compress. If not, you scatter for each other. Okay. So we are sorry that we don't have light this evening, but we are trying to improvise. We're in Cameroon. We have to enjoy it just the way we are. Alright. So from the bottom sheet, we are now going to use our Macintosh, and our Macintosh will be depending on the position for which the surgery or the wound is situated. Let's just say we are doing a bed for a pulse CS. Yes, so the Macintosh will be at the waist length. Yes, you see that the colleague is putting pressure on her own side of the bed to give room for the other, and they will exchange hands in that manner. So you work together as friendly as possible and make sure that your bed remains straight and wrinkle free. So next we are going to use our draw sheet, and because we cannot find the small draw sheet for this big Macintosh, we are going to improvise with a bed sheet. We are going to improvise with a bed sheet because the Macintosh is quite big. let's straighten that there are no wrinkles. If the bed has wrinkles, it is a causative agent that will cause a bed sore. We do not want to hurt our patients. Please don't mind the noise, because we are close to the children's ward and they have to keep talking, so we just have to enjoy it. Beautiful. So you can see how slimless everything looks like. It does not seem like there's even a draw sheet on the bed. That's how comfortable the patient should be on their bed. Now we are going to put the top sheet, and the top sheet has to be, the right side has to be on the side of the patient, and the wrong side has to be on the side of the blanket. Yes. We can do the envelope corner at once with a blanket, in case we don't want to do it one after the other like that. So you are seeing how the both of them are doing their envelope corners at the same time, while compressing it down for the other not to be disorganized. So from the top sheet, we are now going to put our blanket. The hand closest to the bed has to be the hand that lifts up the mattress, while the hand further away from the bed has to be the hand that will do the tucking. Always remember that, don't forget. Madam Beverly, compress for Madam Mary to do, if not you are going to scatter the bed. Okay, so Madam Mary is holding for Madam Beverly to work. You can see her envelope corner right from this side, as well as Madam Beverly is now compressing for Madam Mary to work. Give the kiss first. Your bed is having wrinkles from under. The blanket is not well covered. Remember, it's a closed bed, so we don't bring it right close to down. One step. The step should not be too long. It's our agent of mass destruction. Okay. Madam. So we can see how straight. Just imagine you're sleeping on this bed. There is no possibility that you will suffer from anything. Just imagine you're sleeping on this bed. See, your fever will be gone. Your backache will be gone. There is perfect health in this, because they say the first thing is grooming. You need to groom. You need to groom the environment. You need to make sure everything is clean and straight. So now we are going to go to the pillow And for the pillow, one person holds the pillow while the other person holds the pillowcase. And you tuck in, and the other person will exchange it, and that is how we do it. Don't forget, you cannot do the pillow on your own. It has to be a two-way thing. You should shift on the bed so that we see. I'm sorry that the video is getting darker and darker. That is because it's getting dark out and there is no light. So you see, we cannot stop learning because Cameroon is limited. We have to enjoy every bit one of it. When there's darkness, we dark with it, and when there's light, we light with it. But you can't stop us from shining. Push, push, push. When you see this bed, you feel like you should take 2 days leave and you come and rest your back in the hospital. Okay. So this is a perfect closed bed. Neat, straight. Jesus Christ. If you Yes. Now depending on the side that the patient is entering, now we are now turning the bed from a closed bed into an open bed. You just need to open the bed nicely from one side, depending on which side the patient is going to get into bed.